advancements, what do you see coming next? Do you see further advancements in the treatment forms? Do you see it becoming more common? Like, what's the future hold for stem cell in terms of research and application to patients?
Yeah, so the areas of research are in, well, not in this country, are looking at, working the cell backwards, stem cells backwards into that from multipotent to pluripotent phase where it could regenerate a limb or do a lot more, grow an organ or something. So
Mm.
that's very exciting. It's just a little out of control right now. We don't know how to control that. So that's being looked at. Um,
How is it out of control? Is
well, we
you
don't
just
know
don't
how
know
to
what's going to
turn it
happen?
off. We could turn
Gotcha.
it on. We don't know how to turn it off. So
Gotcha.
you don't want to grow like a liver, oh, we're going to grow you a new liver. And then all of a sudden it won't stop growing. And then all of a sudden you're the human liver or something. So that might be a little over cartoonized, but it requires to turn on and turn off because you don't want it to grow something you don't want, like a tumor or something.
Mhm.
So, but I think more close to the vest is we're involved in these projects to look at what I told you at the outset of this interview. We're looking at certain types of stem cell derived signaling factors or exosomes that come from. We're looking at certain types of stem cell derived signaling factors or exosomes that come from immune cells that can selectively seek and kill cancer cells. So I'm very involved in that. We're looking to do both through IV and injectable, and maybe even as a preventable thing people do, especially if they're at risk, right? That we're looking at these types of things. There are other cancer treatments being studied in this country that pharmaceutical companies are very involved in called CAR T cells, where you sort of use regenerative medicine to have your body sort of create a vaccine of sorts against the cancer cell that might be able to be identified and removed. In addition, we're looking to these stem cell derived exosomes that are specific ones that are chock full of mitochondria. And you talk about longevity and health span and being healthy in your later years and muscle mass and bone density that are important for that. And if we can find a way to support that with more mitochondria in your, being donated back, it might be a really cool longevity hack. So those are the kind of projects we're working on here and that are coming. I think you'll see they're already playing with this in other countries. We're going to be last to the party.
That's, it's really a bummer when you think about all the progress on something like this and how many lives could be saved if we just put the pedal to the metal and caught up with the rest of the world. I just get so bothered by that stuff because and again, it's about the money, right? It's like, we've got to make sure we can make money on this before we decide that we're going to let people get this treatment, even though it's been proven to be helpful in so many different ways.
Yeah, it's money, it's power, which power leads to more money. So the puppet masters. I mean, this is big in many different things, not just medicine or stem cell medicine, but our lives are very highly controlled and dictated for us under the idea of freedom. But is it really?
Oh, well, we could do a whole other episode probably talking about that. I always say, like, we have the freedom to play within the sandbox that they've given us to play in, but we don't know that the sandbox is in the middle of the desert. And there's just so much more we could do.
Fair enough.
There's so much more. So I have to ask this, of course. When it comes to like a diagnosis, I don't know, maybe this would change based on diagnosis, but what side effects do people have to consider? Are there specific types of injuries that this wouldn't work for? Are there things that could go wrong with an injection? Could someone have an allergic reaction? Those types of things that people should consider.
Yeah, let's address this. So there's a hypothetical idea that you could reject someone else's stem cells. I've never seen that. I've never been able to find it in the literature, but we do tell people it's a possibility. When you have a complete bone marrow transplant for leukemia, you're getting someone's stem cells, and it has to be a match. But if you're just getting a treatment with something stem cell based, you don't. So the stem cells are what's called immunoprivileged. The immune system doesn't. They're neutral. Come on in. You're fine here. Yeah, VIP, come on in. So we haven't seen any problems. Now we use a lot of these stem cell derived exosomes, which have even less chance of rejection. Never seen that also either, because they're not even really cells. So they have very few, if any, cell surface markers, which is like the serial numbers. So they go without problem anywhere. In terms of side effects, though, when we do the IVs, if you do have inflammation, your body has to get rid of all those cytokines, and I'll come back to that word, cytokines that's stored up that are pro-inflammatory. So to purge those out through the system, some people might have a day or two of a flu-like symptoms or flu-like syndrome without the flu. So low-grade fever, aches and pains, malaise, tiredness. Because remember the phrase cytokine storm from COVID, when people were in the ICU with all kinds of heart and lung inflammation so bad they couldn't breathe, need to be intubated with a breathing machine and all that. Yep. Well, those cytokines are the molecules that call for the inflammatory immune system to come. So when you have an inflammatory problem, inflammatory burden, an autoimmune disease, arthritis in your body, something, your cells have stored up and utilize and release that information, calling for the immune system, which causes your joints to degenerate and you to feel sluggish and all that. And that you have to get that out of your system. So if you do have a treatment with stem cells or exosomes, your cells have to flip their factories from defense mode to, peacetime production mode. And doing that, they have to release all that old inventory of warheads. So we do see that as a side effect, sometimes actually the minority of people.
How do those release? Is it like sweating? I mean, I don't know.
No. They release from the cell into your bloodstream, and they circulate around. Then you feel yucky, and then they get purged out, filtered out by the kidney and urine, probably.
Okay, so it's like alcohol the next day when you're hungover and you can kind of feel it. Yeah, okay. Correct. But that's not something that goes on for weeks.
A couple of days at the most, we've seen.
Okay. It's like a detox. No,
it is
no
exactly
big deal there.
It is an inflammatory detox. That's exactly what it is.
I've recently been kind of paying attention to, and again, it's all algorithms, how we see everything nowadays, right? But I've been paying attention to like the role that inflammation plays in pretty much every type of illness, it seems like, that we have. Is that something you're comfortable kind of overviewing, like the role of inflammation and why we have so much of it?
Absolutely. I mean, that is the heart of aging. In fact, someone once called aging inflammaging, because really that's what it is. And the faster and the more inflammatory damage our cells accumulate, the faster we look like we're aged and the faster we are biologically aged. And there are tests for that you can do that look at different markers of inflammation. And you can tell what your biological age is, not your calendar age, right? Because, you may be 35, but if you're super healthy and you exercise, you eat clean, all that, your biological age might be 30, right? And that doesn't sound exciting, but if you continue that pace, by the time you're 80, maybe your biological age is 60. So it could be really good, I
really want to do one of those tests, but I'm too scared. I'm going to find out something I don't want to know.
Well, it may wake you up. It may help you make some changes. It may not be. And listen, I have some people who try everything super healthy and they get the tests and they're shocked by the results that aren't that good. And we make a couple tweaks. I have some that we had to tweak the omega-3s. They weren't taking enough good omega-3. They needed more, and a few other little tweaks, and we got there. So it just depends on things. It's worth doing. There are different ways to do it. There are bloodstream markers and there are cell markers, and they all tend to trend the same. So one isn't necessarily better than the other, but the one I've been using is this glycan age test, which is a lot like doing your HbA1c, which is a 3 to 6 month look back on your blood sugar management. Right. And you can know if you're pre-diabetic by that number or how well you've been. And this one will give you a look back like that. It's modifiable. So if you make some lifestyle changes, you can actually change that number.
Wow. I've also recently been learning a lot about blood sugar and insulin and the role that plays in people's health. I do feel one of the things that's good about the internet, which is also the bad thing, is like information's at your fingertips. It's not always the right information, but there's information at your fingertips. Thank you for listening to this clip from the full episode of Eyes Wide Open. Please like and subscribe for daily clips and new episodes that drop every Tuesday. I appreciate you.